I need you to stop what you're doing right now, because what I'm about to share with you in the next few minutes could genuinely be the difference between a normal Tuesday morning and a 911 call that nobody saw coming. I know, that sounds dramatic. I know it does, but stay with me for just 60 seconds, because I've been a practicing cardiologist for over 22 years, and in all that time, through thousands of patient visits, through hospital rounds, through late nights reading the latest research, nothing has kept me up at night quite like this. There is a combination happening right now in medicine cabinets all across America, in the homes of well-meaning, health-conscious people just like you, and most of their doctors have never once warned them about it. We're talking about Omega-3 fish oil, the supplement that half of Americans over 60 take every single day, believing with complete confidence that they are doing something wonderful for their heart. And they are not wrong to believe that Omega-3 is genuinely beneficial for cardiovascular health. I prescribe it myself. I recommend it myself. But here's what almost nobody is talking about. There are two specific heart medications that are among the most commonly prescribed drugs in the entire country for people your age, that when combined with Omega-3 fish oil, create a serious, potentially life-threatening interaction. And the terrifying part? Most people feel completely fine, right up until they don't. So today, I'm going to walk you through exactly what these two medications are, why the combination is so dangerous, what the science actually says, and most importantly, what you need to do about it, starting tonight. Before we go any further, I want to ask you something. Go ahead and comment below right now. Are you currently taking Omega-3 or fish oil supplements? Just comment yes or no. I want to know who's in the room with me today, and I promise you, your answer is going to matter before this video is over. My name is Dr. Anderson. I'm a board-certified cardiologist with over 2 decades of clinical experience, and this channel exists for one reason: to give you the honest, accurate, up-to-date medical information that too many people only wish someone had told them sooner. Let me tell you about Richard. Richard was 71 years old when I first met him, and I want you to understand something about Richard. This man was doing everything right. Absolutely everything. He walked 2 miles every single morning. He had cut red meat down to once a week. He was sleeping 7 hours a night. He had lost 18 pounds over the previous year. His wife told me later that she had never seen him so committed to his health as he had been in those final 2 years of his life. Richard had been diagnosed with atrial fibrillation, AFib, about 3 years before I met him. His previous cardiologist had put him on a blood thinner called Warfarin, which is one of the most commonly prescribed medications in America for people with AFib and heart conditions. Richard took it religiously every single evening at the same time. He never missed a dose. And about 18 months before the event that brought him into my care, Richard had read an article, one of those well-meaning health articles you see everywhere, about the heart benefits of omega-3 fatty acids. He started taking 2 fish oil capsules every morning. His previous doctor didn't ask him about supplements. Richard didn't think to mention it. After all, it was just fish oil. It was natural. He'd seen it at Costco. How dangerous could it be? Here's what was happening inside Richard's body without anyone knowing it. Warfarin works by thinning the blood. Specifically, it reduces the blood's ability to clot. And Omega-3 fish oil does something very similar. It also has natural blood-thinning properties. So Richard, without realizing it, was essentially taking 2 blood-thinning agents simultaneously, and they were compounding each other's effect in a way that his routine INR checks, the blood test used to monitor warfarin levels, were not consistently catching. One morning, Richard cut his hand in the kitchen. Nothing serious. A small knife slipped while he was cutting a tomato, but the bleeding would not stop. He sat at his kitchen table for 40 minutes pressing a dish towel against his hand, assuming it would slow down any minute. It didn't. His wife drove him to the emergency room. When they tested his INR, the measure of how quickly his blood was clotting, it was dangerously elevated. His blood was so thin that what should have been a minor kitchen injury had become a medical emergency. The emergency physician told his wife that if Richard had hit his head or had any kind of internal trauma, the consequences could have been catastrophic. Richard told me later, sitting in my office with a bandaged hand and shaken eyes, "Dr. Anderson, I just wish someone had told me. I thought I was being healthy." That phrase, "I thought I was being healthy," is something I hear more than I care to admit. And that is exactly why I'm making this video today. Now, here is where I want you to take a breath. Because I know that was heavy, And I know some of you are sitting there right now thinking about your own medicine cabinet. And I want you to hear me when I say this. This information is not meant to scare you into paralysis. It is meant to empower you with knowledge. Because knowing this, truly understanding what we're going to cover today, means you can make a simple phone call to your doctor this week and potentially prevent something serious. You have that power, and that is genuinely good news. In fact, let me share something that gives me real hope about this topic. A landmark study published in the Journal of the American College of Cardiology in 2022 looked at over 12,000 patients taking anticoagulant medications and found that when patients were properly educated about supplement interactions and given clear monitoring protocols, serious bleeding events dropped by 38%. 38%. Think about what that number means in terms of real human lives. That number tells me that information saves lives. Your doctor wants to work with you on this. The system works when patients like you are informed enough to ask the right questions. And today, I'm going to make sure you know exactly what questions to ask. So let's get into it. Today, I'm going to walk you through the 2 specific heart medications that create dangerous interactions with omega-3 fish oil, exactly why the interaction happens in your body, what the warning signs look like, and a precise, actionable plan you can follow starting tonight. Let's start with the first medication, and this one affects a huge portion of my audience. I know it does, because it is one of the most prescribed drugs in American medicine. The first medication is Warfarin, which you may also know by its brand name, Coumadin. Now, Warfarin is what we call an anticoagulant. That's just a fancy medical term for a blood thinner. Your body naturally forms clots to stop bleeding, and Warfarin works by interrupting that clotting process. For people with conditions like atrial fibrillation, deep vein thrombosis, or mechanical heart valves, this is critically important because it prevents dangerous blood clots from forming in places they shouldn't, like in your heart, or traveling to your brain and causing a stroke. Think of your blood's clotting system like a chain reaction. One thing triggers another, which triggers another, until you get a clot. Warfarin essentially cuts one of the links in that chain. It's a precise, delicate medication. Too little, and you don't get protection. Too much, and you bleed too easily. That balance is measured by a test called the INR, the International Normalized Ratio, and your cardiologist or primary care physician is likely monitoring this in you regularly if you're on Warfarin. Here's what most patients are never told. Omega-3 fatty acids, EPA and DHA, the active components in fish oil, also have antiplatelet and mild anticoagulant properties of their own. They work through a slightly different mechanism than Warfarin, but the end result is additive. Your blood becomes thinner than either substance alone would make it. And here's the insidious part. Your INR test, which only measures Warfarin's specific effect on the clotting cascade, will not always reflect the full extent of this combined thinning. You can have a normal INR result and still be at significantly elevated bleeding risk because of what the fish oil is doing alongside the Warfarin. A study published in Thrombosis Research in 2021 examined patients on Warfarin who were also taking more than 1 gram of omega-3 daily, which is a completely standard dose, by the way, the kind you'll find in a typical fish oil capsule, and found that their bleeding risk was increased by up to 47% compared to Warfarin users who were not supplementing with omega-3. 47%. And yet, in the same study, only about 12% of these patients had ever been counseled by a healthcare provider about this interaction. So what does dangerous over-anticoagulation look like? What should you watch for? This is critical, so I want you to pay close attention. The warning signs include bruising easily and extensively. We're talking large bruises from minor bumps that you barely remember happening. Cuts that take significantly longer than usual to stop bleeding. Blood in your urine, which might appear pink or brown. Black or tarry stools, which can indicate bleeding in the digestive tract. Unusual bleeding from the gums when you brush your teeth. And most dangerously, sudden, severe headaches, which can indicate bleeding in the brain. That last one is a 911 emergency. Do not wait. Do not call your doctor's office. Call 911. Now, I know some of you are thinking, well, I don't feel any of those things. And that is exactly the point. Most people don't. Until something triggers it. A fall, a minor surgery, a dental procedure, a kitchen accident like Richard's. Here's your action step for Warfarin. If you are on Warfarin or Coumadin and you are taking omega-3 supplements, do not stop either one suddenly on your own. Instead, call your prescribing physician tomorrow morning, or today if possible, and say these exact words. I want to discuss whether my omega-3 supplementation could be affecting my INR levels and my bleeding risk. Then bring every supplement you take to your next appointment. Every single one in the bottles. Your doctor can review your current INR trends and determine whether your monitoring schedule needs to change, whether your warfarin dose needs adjustment, or whether you should reduce or eliminate the fish oil. And here's your pro tip on this one. If you are cooking with fish regularly, salmon, mackerel, sardines, and also taking fish oil capsules, you may be getting a double dose of omega, free from food and supplement combined. Tell your doctor about your dietary habits as well, not just the capsules. Now let me move to the second medication. And this one is going to surprise many of you because it's not traditionally thought of as a blood thinner in the way that warfarin is. But the interaction is real, it's documented, and it affects millions of people over 60. The second medication is aspirin, specifically daily low-dose aspirin therapy, often called baby aspirin, the 81 milligram dose that enormous numbers of older Americans take every single day for heart health. Now, I need to be careful here because the aspirin landscape has actually shifted significantly in recent years, and I want to give you the most current information. As recently as 2019, the American Heart Association and the American College of Cardiology updated their guidelines to actually recommend against routine low-dose aspirin therapy in older adults who have not already had a heart attack or stroke, because the bleeding risks were found to outweigh the prevention benefits in that population. If you are currently taking daily aspirin and you haven't recently discussed this with your doctor, that conversation alone is worth having. But here's where omega-3 comes in. Aspirin is an antiplatelet medication. It works by making your platelets, the tiny blood cells responsible for clotting, less sticky, less likely to clump together. Omega-3, as I mentioned, also has antiplatelet properties through its own mechanism. So the same additive thinning effect occurs here. The combination of daily aspirin and omega-3 creates compounded antiplatelet activity that neither substance would create alone. A 2023 study published in the European Heart Journal looked specifically at older adults, mean age 68, who were on daily aspirin therapy and also supplementing with omega-3 at doses ranging from 1 to 4 grams per day. The researchers found a statistically significant increase in gastrointestinal bleeding events in the combination group compared to aspirin alone, a 31% increase. And gastrointestinal bleeding in older adults is not trivial. It is a leading cause of hospitalization in Americans over 65, and it can escalate from manageable to life-threatening with frightening speed. The reason older adults are specifically at risk is important to understand. As we age, and I say we, because none of us are exempt from this, the lining of our stomach and intestines becomes thinner and more vulnerable. Blood vessel walls become more fragile. The backup systems our bodies use to manage minor bleeding become less efficient. A medication combination that a 40-year-old might tolerate with minimal consequences can create serious complications in a 70-year-old. I want you to comment right now. Are you currently taking daily aspirin? Just type aspirin yes or aspirin no in the comments. This matters because the next thing I'm going to tell you is something your pharmacist may have never mentioned. Let me tell you about Dorothy. Dorothy was 67 when she came to see me, referred by her internist after a hospitalization for what turned out to be a gastrointestinal bleed. Dorothy was sharp, organized, meticulous about her health. She kept a color-coded medication chart on her refrigerator. She had been on 81 milligrams of aspirin daily for 4 years, on the advice of a previous physician. About a year before her hospitalization, she had started taking 4 grams of omega-3 daily, a high dose, but one she had chosen after reading about its benefits for cholesterol and inflammation. What brought Dorothy to the emergency room was a night of severe abdominal cramping followed by what she described as the worst stomach pain of her life and blood in her stool. She had had mild stomach discomfort for about 3 months before that night, which she had attributed to dietary changes. Looking back, she told me, "Those 3 months were my body warning me. I just didn't know what it was saying." After her hospitalization, we worked together to eliminate the aspirin entirely, which current guidelines supported given her low cardiovascular risk, and reduced her omega-3 to 1 gram daily with physician monitoring. She has not had a recurrence in the 2 years since. Dorothy said something to me at her last follow-up that I think about often. She said, "Dr. Anderson, I had read so much about being healthy. I just hadn't read the right things." That is exactly why this channel exists. Now here is your action plan for the Aspirin Omega-3 combination. If you are taking daily low-dose aspirin, your first priority should actually be a fresh conversation with your physician about whether you still need it at all, given the updated 2019 guidelines. Many people are still taking daily aspirin based on advice that is now years or even decades old. If your doctor confirms you should continue it, the conversation then becomes about your omega-3 use and dose, and whether the combination is appropriate for your specific cardiovascular profile. Do not stop aspirin suddenly without physician guidance if you are taking it for secondary prevention, meaning if you have already had a heart attack or stroke. That is a different clinical situation, and your doctor needs to guide that decision. And here is your pro tip for the aspirin conversation. Ask your physician specifically about your current GI bleed risk. There are scoring tools, like the Has Bled score, that physicians use to assess bleeding risk, and knowing your personal risk profile will help you and your doctor make the most informed decision about this combination. Before I go any further, I want to take a moment to say something directly. I see so many of you in my practice who come in with bags full of supplements, all purchased with the best intentions, all from articles and videos and well-meaning friends. And I want you to know, I understand. I genuinely understand. You want to be healthy. You want to do everything you can to stay well, to stay independent, to be there for your family. That impulse is not naive. It is admirable. But the body is a complex system, and adding things to that system, even natural things, even things that are genuinely beneficial in the right context, requires the same careful thought that we give to prescription medications. Omega-3 is not bad. Let me say that clearly. The research supporting Omega-3 for cardiovascular health is substantial and real. The REDUCE-IT trial, published in the New England Journal of Medicine in 2019, showed that high-dose prescription Omega-3 reduced major cardiovascular events by 25% in high-risk patients. That is a remarkable finding. The problem is not Omega-3. The problem is Omega-3 without context, without your doctor knowing about it, without your full medication list being considered. If you found value in what I've shared so far today, this is a perfect moment to hit that subscribe button. I make these videos because I believe that an informed patient is a safer patient. By subscribing, you're joining a community of people who are taking their health seriously and making decisions based on real science. Thank you for being here. Welcome to the family. Now let's talk about what you can do in a very practical, step-by-step way. If you are taking Omega-3 and you are on either Warfarin, aspirin, or both, here is exactly what I want you to do. Tonight, before you go to bed, write down every medication and supplement you take, including the dose and how often you take it. Include everything: vitamins, herbs, protein powders, fish oil, everything that goes in your body beyond food. This list is going to be the foundation of a conversation you need to have this week. Tomorrow, call your prescribing physician, whether that's your cardiologist, your internist, your primary care doctor, and tell them you've been learning about Omega-3 interactions with heart medications and you'd like to briefly review your supplement list. Most physicians will welcome this conversation. If yours seems dismissive, that itself is useful information about whether you need a second opinion. This week, bring that written list to your next appointment or schedule a dedicated medication review if you haven't had one in more than a year. A comprehensive medication review, where a physician looks at everything you're taking and assesses for interactions, is exactly the kind of preventive care that stops Richards and Dorothy's from happening. And here is something important I want to add about fish consumption. If you're eating fatty fish, salmon, mackerel, tuna, sardines, 2 or more times per week, you are already getting meaningful amounts of omega-3 from your diet. Many of my patients don't realize they are effectively supplementing twice, once through food and once through capsules. Discuss your full dietary picture with your doctor, not just the pills. Comment action plan. Right now, if you're going to make that call to your doctor this week. I mean it. Type those 2 words, because I genuinely want to know how many people watching this are going to take that step. Let me tell you about one more patient before we close today. Her name is Patricia, and Patricia's story is the one I always come back to when I think about why this kind of education matters so much. Patricia was 74 years old. She had been on warfarin for 2 years following a pulmonary embolism. She was also taking a fish oil supplement that her daughter had given her, a high-quality brand, 2 capsules twice daily. Her INR readings had been slightly variable for about 6 months, and her previous physician had adjusted her warfarin dose twice without significant improvement in stability. When Patricia came to me, one of the first things I did was go through her complete supplement list. When I saw the fish oil, a picture started forming. We discussed the interaction. She agreed to eliminate the fish oil under careful monitoring, and within 6 weeks, her INR had stabilized at exactly the therapeutic range we were aiming for. Her previous dose adjustments had been compensating for a variable that nobody had identified. Patricia called my office 2 months after that visit. She said, "Dr. Anderson, I've been on warfarin for 2 years, and I finally feel like someone explained what's actually happening in my body." She's now 78. Her INR is consistently stable, and she's been able to reduce her monitoring frequency because her levels are so predictable. That is the power of information. That is what happens when patients and physicians communicate openly and completely. Here is what I need you to remember from today's video. Number 1. Omega-3 fish oil has real, documented anticoagulant and antiplatelet properties. It is not just a harmless supplement when taken alongside certain heart medications. Number 2. Warfarin and Omega-3 together increase bleeding risk in a way that may not be fully reflected in standard INR monitoring. Number 3. Daily aspirin and Omega-3 together increase gastrointestinal bleeding risk, a 31% increase in studies of older adults. Number 4. The warning signs of excessive blood thinning include unusual bruising, prolonged bleeding from cuts, blood in urine or stool, and severe sudden headaches. The last one is a 911 emergency. Number 5. You have a simple, clear action. Tonight, make your list. Tomorrow, make your call. This week, have the conversation. If this video has helped you today, I want to ask you to do something. Share this with one person you care about who might be in this situation. A spouse, a sibling, a neighbor, a friend. You don't need to diagnose them. You don't need to tell them to stop anything. Just say, "I watched something today that I think you should see." That simple act of sharing could genuinely change someone's life. And please save or bookmark this video. The information about warning signs especially, the bruising, the bleeding, the sudden headaches, is worth having somewhere you can reference it or show to a family member. I want to close with this. You are not a passive recipient of your own health care. You are an active participant. Every piece of information you gather, every question you bring to your doctor, every conversation you start because you learned something that concerned you, that is you being your own best advocate. And in my 22 years of cardiology, I have never met a patient who asked too many questions. The ones who asked the most were always the ones who did the best. Comment below with one of 3 things. Comment, "Calling my doctor," if you're going to reach out to your physician this week about this exact topic. Comment, "Sharing this," if there's someone in your life you're going to send this video to right now. Or comment, "Already knew," if your doctor has actually discussed this interaction with you. Because if so, you are one of the lucky ones, and I'd genuinely love to know. Thank you for watching all the way through today. It means more than you know. Take care of yourself, take care of each other, and please, bring your supplement list to your next appointment. This is Dr. Anderson, and I'll see you in the next video.